Science for Everyday Decisions, series by Center for Sustainable Development at the Earth Institute, Columbia University. For your consideration for a more sustainable life through education for sustainable development.
And today we have Dr. Yanis Ben Amor. He is really the person that I go to for health-related issues. If I have any question on policy measures, if I have any question on big picture things, where things are going, especially with the coronavirus problem. So I thought that why not make this CSD, SDSN meeting more public and get everyone on board so that we can all learn from each other and also learn from Yanis. So without any further delay, I know everyone is busy. We'll start the meeting now, and I would like to welcome Dr. Yanis Ben Amor, who is an assistant professor at the Mailman School of Public Health, as well as teaches courses, is the executive director of my Center for Sustainable Development, which works on health, education, a lot of different sub areas, and it would be great to see how the sectors. I want to learn from the health sector and also learn about different ways where we can collaborate. Keep this forum as like an ongoing platform where we can learn from each other, and using this COVID-19 experience to see how we can build an online community so that we can take forward our own initiatives in a more collaborative way. So Yanis, thank you for joining. I know this is a very crazy time and a very busy time for you, so thanks for being online and sharing some of your knowledge and also tips on how and where we should go, what are we tackling with here, and where are we headed. And we'll get enough time to ask questions and exchange our ideas. Yanis?
Thank you so much, Radhika. The first challenge is, do you guys see my screen, COVID-19?
Yes.
Okay, wonderful. So hello, everyone. So my name is Yanis Ben Amor, and as Radhika just introduced me, I am the Executive Director for the Center for Sustainable Development. By training, I'm a molecular biologist, so I am specializing on all types of infectious diseases, primarily actually tuberculosis and HIV and Ebola. And interestingly, now coronavirus. So I teach actually at the School of International Public Affairs, a class on global health for people who are not health experts. And when this new disease started to break out in China, I started talking about it kind of casually on the side until I realized this is turning into something more significant for the world than originally thought. So I only have 15 slides. This is supposed to be relatively basic, but of course, during the Q&A, you can go into more detailed questions, and hopefully we'll have time to answer those. Okay, so you can see the slides, yes?
Yes.
Okay, great. So just to start off, how do you know that you have an infection with COVID-19? And just for terminology, it was originally called the Wuhan flu or the Wuhan coronavirus. And then for stigmatizing reason, that name was luckily changed by WHO to COVID-19, which stands for Coronavirus Disease 2019. The symptoms are kind of similar with the cold and the flu. We now know that mostly somebody who is infected with coronavirus will systematically have a dry cough, mostly a fever, and then in the more severe cases, shortness of breath. And what you should do to avoid it is wash your hands regularly. If you are sick, stay at home. Cover your cough because it is an airborne infectious disease. Stay rested. And if you think that you are sick, before you call the healthcare provider, make sure that you have all of the symptoms so as to not overburden the healthcare system. So Radhika, I'm not sure whether I should just go through the entire presentation or wait at the end of every slide and see whether there are questions.
You can go over the entire presentation, Yanis, and go slowly,
okay.
because some of our youth have joined and they probably So maybe slowly a little bit more. Yeah.
Okay, so this is a map of the world that shows you how bad the situation is as of today. And if you are like me, you've been following this literally since day one. And the map went from having just one dot in China to now being basically covered everywhere. So as of this morning, when this screenshot was taken, we are at 170, close to 175,000 cases worldwide. China is still the number one, the country with the highest number, but it's closely followed now by Italy and Iran. The number of deaths are above 6,500. And if you look at, and it's in 155 countries. If you look at the bottom right side, you see in orange how the infection has evolved in China and why it gradually went up from January until March, and then it kind of stayed steady. And now what we have, the problem is, if you look at the yellow line, it's COVID-19 outside of China, which was completely stable until beginning of March, and now it's just exponentially growing. And as of yesterday, in fact, the number of cases outside of China have now surpassed the number of cases within China. So we are now again at the new turning point. So how did we get there? And this is a slide from my presentation that I gave at SIPA. The first time that this was reported really was on the 1st of January 2020, when the South China Morning Post, which is kind of the equivalent of the New York Times, reported in the central Chinese city of Wuhan that they were investigating an outbreak of a viral pneumonia of unknown origin. Only 5 days later, the mystery outbreak was considered not to be SARS. So for those of you who remember, and I will get back to that in a few minutes, there was an outbreak of a respiratory disease called severe acute respiratory syndrome back in 2003, also in China, and it was caused by a virus called coronavirus. And they immediately looked into it, and it was not the SARS of 2003. On January 6th, the number of cases were just close to 60. They had not reported any cases outside of the country, and they were thinking, okay, we haven't completely identified what it is, but we believe it's a coronavirus. And it's interesting to note that at the time, there had still not been any deaths, but more importantly, there were no reported transmission from human to human. How the situation has evolved. So just to go back to coronavirus, because everybody is using that word, and you may not know that the one that we are currently suffering from, so COVID-19, is part of a large family that has been causing many infections throughout history. And I am reporting here two that were notable in the last decade, or in the last 20 years. So if you look in the middle, the one that I was just talking about, in 2003, was the outbreak of severe acute respiratory syndrome. It also originated in China. The death rate at the time seemed to be very high at 650, which is now, of course, nothing in comparison to COVID. And it killed mostly people in China and Hong Kong, but it was a worldwide infection. There were cases in Ireland, there were cases in Toronto, and apologies for the noise behind me. It was thought to be originated in bats, and it was spread to civet cats and then to humans. Similarly, there was another coronavirus that made the news in 2012, and that was MERS, Middle East Respiratory Syndrome. This one was first identified in Saudi Arabia, and it killed 800. At the time, that was also considered to be a lot, and we believe that it moved from camels to humans. Now we have this new strain, COVID-19, identified in Wuhan, late December, early January, and this is going to be the focus on this talk. So it's not the first time that we have to deal with what we call a zoonotic infection, meaning that it's a disease that started in animals and then jumps and starts infecting humans. So if you look on the left, the first example was the SARS that went from bats into the civet cat into human, MERS from bat into camel and then into humans. And for coronavirus, we're not completely sure we know that it also started in bats, and it was a bloodborne disease in bats. Then it moved into snakes, possibly, and then from snakes, it then moved into human, and then from human, it started going from human to human. So if you are looking at how coronavirus compares with other diseases in terms of mortality, it is not as bad yet. For example, Ebola, on average, has a mortality rate of 50%. So that's the highest one that we know. Back in the days, there was a disease called smallpox. Luckily, we were able to eradicate it, but that mortality was between 30 and 40%. MERS that I just introduced, the mortality rate was 35%, so very high compared to COVID. SARS was also high, between 9 and 16%. And now, you know, coronavirus is sort of like 4%. But the issue is that it is a new disease, and numbers are evolving on a daily basis. So the original figures that we got were from the infection in China. Now that the infection sort of is worldwide, we have to reassess this mortality rate as more people are getting infected and more people are dying. So in fact, the sort of like blanket mortality rate of 4%, now that we have a larger, unfortunately, a larger sample size, we realize that the mortality rate really depends on your age group. So if you are infant 19, 20 to 39, or in your 40s, the mortality is actually very low, less than 0.5%. In your 50s, it increases to 1.3, and then in the 60s, goes up to 3.6. In the 70s, it really goes up around 8%, and then in the 80s, it goes up to 15%. So, and that probably has to do with the fact that as you grow older, your immunity sort of wanes off, and the infection is then able to have more fatality. So words that you've been hearing for the last week, the World Health Organization has been tiptoeing around this for the last 2 months. Is it a pandemic? Is it not a pandemic? So I'm just going to quickly go through the terminology. You may have heard that a disease is endemic. That's typically discussed when a disease is always there throughout the year. For example, it could be the flu, that's an endemic disease. Then you have epidemic. That's when you go from almost no cases to all of a sudden, very quickly, a lot of cases. But it is limited geographically to one region only. So that would be epidemic. So now, as of last Wednesday, the World Health Organization has declared that COVID-19 is a pandemic. What that means is that it's an epidemic that is now everywhere in the world. In fact, we are at 155 countries. There are almost no countries that have not reported cases of COVID-19. And in most of the countries, there is community spread. So people are transmitting the disease within communities. So this discussion would have been very different 2 months ago as it is now. What are we supposed to do? What were we supposed to do? There is one thing that we were supposed to do very early on and we didn't do, and that's testing and figuring out, you know, how bad is the situation. And so the first thing that you do to prepare against a pandemic is rapid identification and situational awareness. Obviously, if you have 6 cases, it's very different than if you have 6,000 cases. But the problem is, if you don't test and you don't know whether you're at 6 or 6,000, you cannot take the appropriate measures. Obviously, if you don't test, it looks like you have 0, when in fact you don't. You already have spread within the community, which is probably what was happening in most cases outside of China. You want to do risk communication very early on, explain to the population how bad it is going to be for them, for their daily life, so that you make sure that the population, you know, plays their critical role. And you will see how that is important in what is happening to us in the coming days. To reduce the spread, there are multiple ways you could do that. They were not taken soon enough, unfortunately, which is why we have this problem in the world. Quarantine is a good one. That's what China did very effectively, but in a way that almost no other country could do, where basically they locked down the entire region of Wuhan of 50 million people. People were locked inside their homes. Nobody was allowed to leave. The result is that they were able to turn their situation around in 41 days. Other countries are going through travel restrictions. If they feel that they don't have a lot of cases and that there are other countries that have more cases, that they would want to restrict the people coming from those countries into their own country. In the long term, what you want to do is reduce infectiousness of symptomatic patients. So this is a viral infection, so you would want to develop antiviral drugs. Unfortunately, none of the antiviral drugs that we currently have for other viruses work against COVID-19. So of course, the pharmaceutical sector is working very adamantly at trying to develop those. And then ideally what you would want to do is to make sure that people don't get sick in the first place. And that's what you do, for example, with vaccination. And then same situation, because this is a totally new virus. It's not a new, it's coming from a virus family we know, for which we don't have a vaccine. So now we are trying to develop new vaccines. The estimate is that there will not be a vaccine for the next 12 to 18 months, although today it was just reported that they started the first vaccine trial in the United States, phase 1. So clearly it's moving forward. So I want to finish this by giving you the example of a country outside of China that had a complete breakdown and of the health system because of COVID-19, and what we can learn in the United States and try to not replicate the Italian example. So Italy had their first case on February 23. And you can see on this graph, in blue are the cases in Italy. So day 1 in blue would be February 23. You can see that between day 1 and day 10, the infection progresses relatively slowly, from a few cases to quickly 2,000 cases. But what's notable is what happens in the next 10 days. Between day 10 and day 20, you go from 2,000 cases to close to 20,000 cases. So Italy did not originally respond adequately when they had their first cases. In fact, for example, when the first cases were noted, large cities like Florence and Milan and Rome organized massive celebrations outside to try to show the tourist sector that Italy is not afraid of coronavirus. Now, of course, that is a very idiotic way to act with an infectious disease that transmits by, airborne and from contact to contact. And it's probably one of the reasons why Italy is now the second largest, has the second largest infection outside of China. So what happened is finally, when the cases started to go above 5,000 around day 13 of the infection, the measures started to become more drastic. And 2 regions of Italy were then put in lockdown: Lombardy, which you can see is represented by the largest city, Milan, and the region of Veneto, which is represented by the city of Venice. And that at the time represented 16 million people who were supposed to stay in their region and reduce travel. And it was not completely a quarantine, it was just preventing movement from this area that had the most cases in Italy to the south that had none or had very few. Unfortunately, that lockdown was not put in place very effectively, and people continued to move to the point that Italy then had to take extreme measures. And early last week, the entire country went into full lockdown. So 60 million people are now quarantined at home, with no access to anything except grocery stores, banks, and pharmacies. So now, if you look at what's happening with the United States, the way that I like to explain this is that think about it as a moving storm on a map. China was the first one that was hit, and it hit China 2 months ago. A lot of the countries should have taken that opportunity, just like when a snowstorm moves on a map, to get ready for the snowstorm to come and hit them. They didn't. And so then it hit Italy, it hit South Korea, it hit Iran, and then now the rest of the world started to pay a little bit more attention. And if you look at the comparison between Italy and the US today is at day 10 of where Italy was. You can see on this chart the numbers in the US in red. So what does that mean from here? Well, we could decide to be complacent, just like Italy was, and think, okay, the numbers in the US are not going to increase, just like what Italy thought in the beginning, and lose precious time. Or we could try to put in place immediately measures that were shown to be effective, even though, of course, they're going to affect our daily lives. So one of the most effective measure is called social distancing. And quite simply, it means because it's an airborne disease and it is transmitted through contact with other people who are infected, if you limit the interactions of people on a daily basis, you are going to significantly slow down the infection. So why is that important? Why do we want to slow it down? At this point, it seems quite difficult to imagine that this will not be bigger and worse than it is. What we are trying to do is what experts are called flattening the curve. So on the left side, you have what happened in Italy. You can see the dotted line shows what the healthcare capacity is in terms of number of cases that are severely ill that they will be able to treat and take care of. And in Italy, because they did not immediately put in place proactive measures such as social distancing, quarantine, travel restriction, their number of cases in 20 days increased significantly to a point where now in Italy, it is heartbreaking. Doctors have to decide whether a patient will make it or not, because they can't treat everybody, because the healthcare system is completely overloaded. They will decide if you're an 80-year-old person, you are likely not to make it. They will not give you the same attention as if you are 30. So in the US, we can still prevent that. And that's what would happen with protective measures. So you can see that the number of cases would not necessarily be less. They would just be less immediately. You are spreading them over time so that the healthcare system never gets to capacity. And I'm going to finish on this last slide, which shows New York State restrictions as of today. So in order to basically help with the social distancing, to make sure that we are reaching this flattening of the curve, you probably heard that as of today, all of the schools are closed until further notice. Some people, for sure, until the end of the academic year, and some people even think that at this point, the schools will be closed until January 2021. As of today, no more gatherings of more than 50 people. All the restaurants and the bars are going to close tonight at 8 p.m., but the deliveries will remain. The gyms are closing. So there are travel restrictions from most European countries, as you heard from President Trump on Wednesday night. So this is a national restriction. To this day, unlike what France just instituted an hour ago, there are no curfew and no travel restriction, no movement restriction on the national territory yet, but this may change. And if you've seen the press conference about 30 minutes ago from President Trump, they are now launching a new initiative called 15 Days to Slow the Spread, which are initiatives that everybody should put in place to make sure that we are stopping the spread. And these initiatives are making sure that you don't hang out in large groups. If you are sick, stay home. And if you are sick, then your entire family will be quarantined for 15 days. So let me finish on this note. I think that everybody has a responsibility. Nobody should be complacent, not the 30-year-olds, not the 40-year-olds, not the 20-year-olds, and think that this is going to be somebody else's problem. What seems to be happening is that there are people who are carriers of the virus that look healthy and may unknowingly be passing on to other people. So if you continue to interact with others, for example, your grandmother, and you are shedding the virus, you may be putting your grandmother or other people at risk. So I think that the restrictions that are in place now are good. I think that the US is a little late, but still we are ahead of what Italy did and what France did. And so I really hope that if people are respecting those restrictions, meaning, well, obviously you can't go to brunch anymore because all the bars and the restaurants will be closing. Stay away from people, stay at home unless you have to leave. And within 15 days, we will reassess the situation and see how effective these measures were. Thank you. So I will be taking questions now.
Thank you, Yanis. Super informative. Are there any questions?
I have one question.
And please state your name first and introduce yourself.
Ishika.
Tell me again, sorry.
Ishika.
Yes, Ishika.
If the coronavirus is if it's airborne, is it still safe to walk outside?
Okay, so that's a very good question. Because it's airborne and it's transmitted from people who are coughing and basically putting the virus in the air, but when you cough, the virus typically stays in the air and then falls on the ground. They say that if you stay 6 feet away from people, it should be fine for you to walk outside.
Okay.
So that's the idea of distancing. In Italy, when people go out to the grocery stores and the bank, there are marks on the floor outside that remind people how far they have to stay from each other, so that if somebody has the infection and they cough and they don't use a mask, that you still would not breathe in the virus.
Hi, this is Kumkum, Ishika's mom. I have a question here. As you said that if person is sneezing, then only, like if you're 6 feet away, you are safe. But the viruses are actually falling on the ground, right? So how much time it requires to be inactive? Some people are saying 7 hours, some are saying 9 hours.
So
requires the host, and host is actually the human body, right?
That's right. So although we do know, just like the flu virus, that it stays alive on surfaces for a certain amount of time. Now, just like I told you, this is a new virus. We only know it since January. We've been studying it only since January 2020. So we're finding a lot of new information. There is a study that came out last week that said that unfortunately, this virus can stay alive for many days on certain surfaces. We know that it typically doesn't like porous surfaces. So for example, paper, cardboard doesn't like it very much, but iron, steel, concrete, it could stay for many days. So what I would recommend is whenever you have a doubt, just wash your hands for 20 seconds with soap or with alcohol at 70%. And avoid touching your face, so that you wouldn't go from the surface with the virus to where the virus will enter your body.
Thank you.
Hello. Hi, Yanis.
Hello.
Hi, everyone. This is John Mugabo from Rwanda.
Oh, hi,
Thank
John.
you so much. Hi, long time.
Long time.
Thanks for sharing this. I have two questions. One is on testing. We realize that in most of our countries here in Africa, we have less numbers of infections, of cases of people have been affected by this. So could it be because we are not able to detect this, or possibly there is we could be having more numbers than what we are able to detect, because we are not actually testing everyone. So you find that, for instance, in Rwanda, we have 5 cases so far, and most of those are people who have come from out. Probably they were able to detect because they have strict measures on the entry points. but we could be having more other cases in the country that we don't know. So it's a worrying situation, but we can't tell. The second is on social distancing. You talked about 50 people plus, a group of around 50 and more. Asking myself, why 50? Is it the minimum? Why the 50? Because some of the classes that are being closed, the schools, they have less numbers, but they are being closed. So why the 50?
Okay, so let me start off with the first one. You are very right. If you are not looking for them, you are not going to find them, and it's going to look like you have no cases when in fact you could have many. So for a very long time, if you looked at the map of where coronavirus was, Africa looked like it was spared. And it's possible that the travel, the migration flows made that there was no entry of the coronavirus into the African continent. Honestly, I doubt it. It originated in China, then it blew up in Iran, then it blew up in Korea, then it blew up in Italy. We do know that there are many Chinese workers in Africa. We know that there is Italian tourist migration or work migration on the African continent. So I have a feeling that just like in the US, by the way, there are a lot more cases that we just have not diagnosed yet. Interestingly, when a country starts to diagnose, you'll see that the numbers go up really rapidly, and then the population starts to get really worried. But in fact, it should be the opposite. When you start diagnosing a lot of people, it's a good thing. It means that you know who is infectious, and you're able to take measures to either put them in quarantine or to give them the care that they need. It's much better than to have a fake zero, if you will, a country who would say that they don't have any coronavirus case just because they're not testing. And then in fact, it's spreading in the population. So there was a map that was circulated by the CDC about Africa that showed that less than half, this was end of February, February 27th, that showed that only half of the African countries had the technology to diagnose COVID-19. So like I said, I do think that the numbers are probably higher than what they are. So about 50, it's interesting. This question was asked just half an hour ago to the head of the NIH, Tony Fauci. It's because of mathematical modeling, and you will see that that number has constantly changed in the last week. In the US, they started banning groups more than 1,000. Then they went to 500, then to 100, and now it's 50. There isn't really a logical reason more than to say, look, we want to make sure that in any location, there aren't too many people, so you cannot respect the 6 feet distance from one person to another. So it's not based on science. It just seems to be common sense. So I hope that helps.
Yanis, 2 questions from Gianna.
Hi, I'm Gina Wertenberg with Rutgers University. I have 2 questions that are sort of related. First is, do you have any idea how long this may last, and if warmer weather may help slow the spread? And related to that, do you think there's any relationship between this pandemic and climate change? Thank you.
Thanks for the question. So I don't know whether you have watched the press conference from our president half an hour ago.
I did.
Now, if you remember, just a month ago, he was saying, oh, there are only a few cases in Seattle. It's going to be gone by a week. Now he's talking about July, August. And if you have watched the entire press conference, you noted that Tony Fauci ran to the podium to say, okay, what the president is saying is not that these emergency measures that we're putting in place will be in place until August. The emergency measures of, closing the bars, all of this, will be for a period of 15 days, and then we will continue to reassess. This is a new virus. We don't know how it's going to act. This is the first time we are moving with this virus to the summer. So is it going to be like the seasonal flu, where there is a season, and when hot weather with higher humidity comes, there typically is a decrease in transmission? We all pray and hope that that is the case, because that will help us make sure that we turn the curve. But there is no way to know. There is no way to know. So SARS stopped because of strong measures in March of 2003. MERS, there's still some transmission here and there, but mostly it's been contained. So this is the first time that we have such a large spread of a new virus in less than 3 months. I mean, January 1st to March 16th. So that's why I would say the next 2 weeks are going to be critical. Let's not wait for the weather. Let's not assume that the weather has to help us. Let's all play our part, young and old, and be active members of this society. The French president gave a speech an hour ago, half an hour before Trump, to say, so Trump spoke on Wednesday, the French president then spoke on Thursday to give similar restrictions, not about travel, but to close restaurants and bars, and realize that over the weekend, people didn't follow. Some restaurants stayed open, people ended up going out, people, you know, masked in parks in large numbers, and he called them criminals. He said, you are the reason why the health system is collapsing, because you are not understanding how serious this is, because you think you are young, because you think that you are immune, but you don't realize that you can be carriers and infect other people. As a result, I am now putting a national lockdown. There will be no more movement on the French territory. And he called it a war. He said France is at war with coronavirus. So the US, we are still a little behind in terms of number of cases, although we don't know because we're not testing. It could be 10 times worse. We could already be at 30,000 cases. You know, we are 350 million people. It wouldn't be surprising. So for the second question, the spread could probably be due to climate change, but it's difficult to know. I would say something like Zika was more likely to be due to climate change because you needed a mosquito to carry the infection. And we know that climate change had an impact on where this mosquito was located, and it actually facilitated the spread of Zika 4 years ago. I'm not sure, it has not really been shown that there is a direct link between climate change and COVID right now.
Thank you.
Vidya and Veda have a question. Girls?
Yeah. Can you hear us?
I can hear you. Hello.
Yeah, I'm Vidya. So, people are saying that wearing flu masks would help with the coronavirus. But the thing is, wouldn't you want to touch your face more then to adjust it? Because I get that it covers your nose. Well, maybe not your nose, but your mouth. So you wouldn't touch your mouth, but then you would touch like your cheeks more because of the straps to adjust it. So would it be a good thing or a bad thing?
So it's very true. First of all, let me show you that the only mask that protects is this type of mask that's called N95. You see that it has that little chamber here in the middle. That's a place where the air goes through and is filtered, and it actually is so tight that bacteria and viruses cannot go through. That's the only effective mask. You probably won't find them. They're all on stock out. What I would say is this: masks are not the way to go if you are healthy. Masks are the way to go if you are sick, because when you are sick, you cough, and when you cough, you are projecting the virus into the air. If you wear a mask, that cough actually gets stopped onto that surface. But you are right. If you are not sick and you wear a mask, and you're not used to be wearing a mask like that, the tendency is you think that you are protected, and you may want to adjust it constantly. So you are touching a surface that may have the virus, and then you end up, touching your eye, touching your nose. So what really works: wash your hands frequently with soap, with alcohol, and stay home.
Okay, but the thing is, you said that if you were sick, then you would wear the mask. But if you were sick and you coughed, it would get stuck on your mask. So let's say you were spitting out germs, basically. But then wouldn't you start breathing those germs back in? So then how would you get rid of the germs inside?
No. That's not how that works. You don't reinfect yourself. So you are already carrying the virus. So you should not be worried about breathing in the virus. What you should be worried about as a sick person is to make sure that you are not coughing it into the air and somebody close to you will then get the infection. Number one. Number two, anyways, if you are sick, you should be staying home. So you should be wearing a mask if, for example, you are living with other people and they are in quarantine with you and you want to make sure that they don't get infected.
Okay, so I have a follow-up question. I'm their mother, Nidhi Thakur. So the question is that you just mentioned that there is no chance of reinfection. That means, should we assume once a person has been infected and overcome, they are kind of free, they've built an immunity from it and not going to get it back again in the, so there are no chances?
I wish I could say yes, 100%. There are what I would say anecdotal examples of people who had it, were shown to be cured and then got it again, but not from themselves, clearly. They got it from somebody else. But these are still anecdotal. Now, it seems that the community thinks that once you had it, you have an immunity and you are less likely to have it. That's the reason why we want to work on a vaccine, because otherwise the vaccine wouldn't work. Today, for example, I also heard that, okay, this is going to be a little technical. They are actually going with people who had the infection and successfully fought it, who are now cured, and they are harvesting their immunity, and they're going to be injecting it to healthcare workers to make sure that the healthcare workers are protected. So it's like an indirect vaccination. Instead of getting a vaccine and developing your own immunity, you are harvesting the immunity of someone else and getting that as an injection. They do that. They do that. For example, tetanus is an example where you do that. You actually, when you cut yourself with a rusty metallic object and you worry about getting tetanus, you're going to get the tetanus shot, which is actually antibodies from horses that will make sure that you don't develop the disease. So in this case, they find people who had the disease, they harvest the immunity, and they inject it to healthcare workers to make sure that they don't get sick.
True. Okay, great. Thank you.
There's a question from Germany. I'm not sure who the person is.
They're staying up late?
Yeah. Okay, we'll go over to the question from Will. And also, Ozge, you wanted to say something? Maybe Ozge can go first and then Will. We can't hear you, Ozge. Is your mic off or mute? Are you on mute?
Can you hear me now?
Yes.
Okay. I was just going to say that we don't know yet if the virus will mutate. I mean, the genetic material will change or not next year. Like, we can have flu every year because the flu virus changes. So we don't know how this virus will behave next year.
Very true. So
So we now have two subtypes. One is more aggressive than the other. So if you're infected with the less aggressive one, you get less symptoms and a milder disease. But if you have the other subtype, it's usually more severe. We don't know how these subtypes will behave next year. So we'll probably see in time. Thank you.
That's true. What Ozge is making reference to, for those of you who are taking the flu shot every year, is that you never know whether you will be covered. And it has to do with the fact that it takes about 6 months for the flu shot to be made because of the way that it's prepared. And you cannot anticipate necessarily what flu will be the one that will cause disease the year after. So if we only have these two types of coronavirus, COVID-19, we'll see if the virus is effective. If it starts to mutate and there are multiple substrains, we may actually have the same problem as we have with flu, meaning that they will develop a vaccine and it's not sure that it will protect you for whatever infection comes the year after.
So, Yanis, I think there's a similar question Ishan has. Ishan, do you want to ask the question?
Yeah, I was just gonna ask, is there like a quick way to tell the difference between coronavirus and like allergies? Because sometimes the symptoms are the same.
Right, that's a very good question. So you will also have a cough. so the thing is, there is a lot of sneezing and allergies, and that has not necessarily been seen with coronavirus. That question was asked earlier at a press conference, and the expert said, look, if you really want to be sure, take your anti-allergy meds. If the symptoms go away, you are likely not to have coronavirus.
Okay, thanks.
David has a question on the time it will take to develop a vaccine and why does it take more than a year. David, do you want to elaborate, or maybe Yanis can answer?
Well, if you can answer, because just today just mentioned 6 months to develop a vaccine. Earlier, we were talking about more than a year. Maybe that was to get it widespread in the population. Anyway, if you could just elaborate on what the factors are.
Right. So you want to make sure that the vaccine will be effective, and you want to make sure that the vaccine will be safe. So in order to do that, we have what we call clinical trials with phases, phase 1, phase 2, phase 3. And each of the phase has to have a certain number of patients enrolled, and you need to have, it basically goes through a series of gates, if you will. And there are very promising drugs, very promising vaccines that go through the first gate, and then they are stopped because they don't make it through the other gates. So first, you are going to give it to people who are healthy to show that it doesn't have side effects. And then you're going to give it to people who are sick and show that it protects them. All in all, that's the reason why you can't, even if you think that you have a good vaccine or a good candidate or a good drug, a good antiviral, you cannot just give it to people, because it may have side effects that you don't know about. Everybody's going to die of a brain hemorrhage, but will not have COVID-19. So that's the reason why they suspect it will take between 12 and 18 months before they can find a good candidate.
So my question, Yanis, how do you think, given the proactive measures that we have right now, do you think, how long do you think this misery will last? And can we go out and enjoy the weather? When do we do that? Because we are now at home, kids are at home. It's difficult to sustain this momentum for long. So just any hopes on when will this misery end? And
so I am sorry to say that I don't know, and nobody knows, because it is, if the problem was limited to New York City, if the problem was limited to Seattle, it would be one thing. But it is worldwide. The chances of it going away and coming back is very high. Right now, of course, there are travel restrictions. So every country is sort of like dealing with it on a national level. They're trying to refrain the chances of reinfection, right? So Canada closed its border, all of the EU closed its border. Countries like Germany even closed their borders inside the EU. So you're not able to go from France to Germany anymore. I will say that we are lucky that it hit us kind of like last. Of course, we should have been preparing since January, because we do have Chinese nationals who live in the US, Chinese nationals who are also American nationals. We knew that there was a possibility of this infection to come to the US. It actually did. The first case was noted mid-January. The first cases in France was end of January, but people didn't take it seriously. So now, the restrictions that are put in place, I think, are good, as long as people are actually following them. The next 2 weeks are going to be determining how long this will last. If everybody plays their part, there is a possibility that we can make a significant impact. I don't think that it will be over by April 1st, but there is a chance, if, you know, weather has an impact, if everybody does social distancing, that by mid-May, we can have a handle on that. But it doesn't guarantee that it will be gone forever, and it may not come back next year. It's a very high possibility that a year from now, we start all this again. And then it will depend on every country to decide, okay, do we want to protect the public health of people, or is it more important to protect the economy? Because the impact that coronavirus has right now, we do not even understand. Today, Austrian Airlines declared that it will close, and that's the first of the large airlines. Air France is talking about big difficulties. British Airways, of course, because nobody wants to travel. Travel restrictions are everywhere. This is going to have a massive impact. So I know you were hoping for words of comfort. The words of comfort are, we are now acting, and we are not Italy, meaning we didn't wait until our cases were, 20,000. We are still considered to be low for the 350 million. So if they continue to be aggressive, then we could turn this around. There is no way to tell how the next few days are going to be. If, for example, they realize, like in France, that people don't care about the restrictions, they still go out, then we may move to something more drastic, which is the quarantine and the restriction of movements, which means that people will not be allowed to go from New York to New Jersey anymore, which of course will be significant. There was another question that you had. Oh, going out. So it's very interesting. So the French president said that all the people who went out this weekend and went to the park were criminals because they were helping with the transmission. Meanwhile, our governor, Cuomo, said the opposite. He said, you know what? We know that you are locked inside. Go out, use the parks, go to the fresh air. So what I would say is this. Don't organize large birthday parties in the park because that defeats the purpose. Don't do a quinceañera. Don't do a, a girlfriend bash. Just go out, maybe go for a run, stay away from people, and you should be fine. I don't think that going outside should be restricted unless you live in Times Square and there's like 100,000 people around you.
Mm-hmm. So Yanis, we personally, people know, stay indoors, avoid people. You made it very clear. What have health personnel learned from this episode? Just wanted to know that, is it something that you had seen before, but now in a much larger scale, but the nature of things remain the same with Ebola and with Zika and dengue and other things, or has the health community learned something else from this, which will turn out to be a policy measure internationally or WHO recommended thing later on? I know too early to say this, but how different is this from the rest?
I think because we are still in it. I'm sorry, I'm going to mute myself because there's a siren. One second.
And shortly, you can go. It's okay.
Are you sure?
Yeah.
Really? Thanks, Mama. No, I want to stay.
Okay, the siren is gone. So because we're still in the middle of the crisis, it's still too early to see what we will learn from it. But I would say that maybe 10 years from now or 20 years from now, when there is another disease that starts in a country and starts to spread, I would say that people hopefully will take the lessons, which is to limit the movements very early on. Screen at airports, making sure that nobody is bringing the infection in a new country. For the health system, what we're realizing is that we were severely underprepared. There was the debate on Sunday between the two Democratic candidates, and one is trying to push for a model Italian style, which is everybody gets the same healthcare system. And then the other one said, well, look, Italy is completely overwhelmed, so your system doesn't work. It's not true. The thing is, Italy probably has a fantastic healthcare system that was not prepared for such a quick overload. As you remember from my slide, the very quick increase. So the next disease may not be respiratory. The next disease may be something completely different, So for example, right now, we're realizing that we may not have enough respirators for people who have severe cases. When they looked at the comparison between Italy and the United States, we actually have less per 100,000 people than Italy, and they are overwhelmed. They have 32 per 100,000. We only have 28 per 100,000. So, we are the biggest, best democracy in the world. Our healthcare system is clearly not ready for this. So that's why acting early is so essential, so that we don't end up being like France and Italy. But whether there are any lessons, we'll have to wait until it ends and see what policies come out of it. Look at, just to give you an example, in the middle of the SARS epidemic, people ramped up research to try to find a vaccine. As soon as SARS was over, all of the funding went away. We still don't have a vaccine against SARS. If they had continued to work on it at the time, we might have a tool. Because they are cousin viruses, the vaccine for one could have worked for the, at least we would have something to work with. They didn't. Ebola is the same thing. Everybody rushed to give money on Ebola, healthcare, health systems strengthening, etc. Ebola went away, people stopped working on it. It's just the nature of things. Now, more countries are affected, obviously, than back in 2014 with Ebola. I think the repercussions are going to be longer. Hopefully, we will learn.
Thank you, Yanis. Nidhi has a question. Nidhi, we can't hear you. You have to unmute.
Okay, can you hear me now?
Yes.
Yes.
Okay. So my question was that, you mentioned that it first started in China, and that is something we all know. And you would know that there is an increasing sense of it started in China. Why did it have to spread across the world? Of course, we all know it is a function of the globalized world that we live in. And therefore, a pandemic like this has a strong sense of aftercurrents of xenophobia, as well as complete lockdown on globalization, immigration, movement of people and goods and services. So there are all these societal after effects which are going to linger. So do you have a narrative that we can scientifically create that no, that is still okay? Diseases can be controlled. This could have been better managed. We can point fingers to how we manage the disease, but pointing fingers to people's mobility and just the idea of immigration. How do we counter those two?
This is a very difficult question. Unfortunately, many countries are going to be using this in the future to strengthen their ultranationalistic views. We have noticed since Trump's election, a little bit everywhere in the UK, in Hungary, in Italy. A lot of the countries are going nationalistic, US first, Italy first. And this type of worldwide catastrophe is certainly not going to help change these people's minds. Yes, it started in China. Yes, it probably started with people eating infected snake. And then from there it spread. We have seen the racist comments. We have seen the worst of humanity when it was still just in China. People of Asian descent worldwide being looked at, and you wouldn't want to sit next to them in the subway because maybe they have coronavirus. This is not the way to act. It was the failure, I would say, of the Chinese government in the very beginning to be transparent about the problem that they had when they only had 50 cases, when they only had 100 cases, that they should have been transparent. If they were unable to contain it, if they were unable to understand what was going on, they should have opened it up, asked the WHO, asked international experts, and as a concerted effort. Maybe the situation would have been different. I do hope that China and others learn from that. MERS started in Saudi Arabia. SARS started in China. Ebola started in Ghana and then moved over to Liberia, Sierra Leone, and Guinea. So diseases start in many countries. It's not always the same. What's important is be transparent. When the epidemic of Ebola hit the 3 West African countries, clearly they didn't lie about it. Very early on we knew, and the world started to react. So about travel bans, I don't know. It's a difficult question. The thing is, if China had been transparent, we would have known about these cases early in January, before people who went home for Christmas, for example, decided to go back to Seattle, decided to go back to Italy, decided to go back to France. And maybe if we just at the time, just used 15 days, this could have been prevented. Because you had few cases, you would wait for, now of course it's easy, like I say, hindsight is 2020. We didn't know anything about this disease at the time. We didn't know what it was. We didn't know the incubation time. Now we know a lot more. with just 15 days, keep them grounded, make sure that they don't develop symptoms, then they can travel. Maybe this would have been prevented.
Okay.
But it's difficult.
Thank you.
Thank you, Yanis. I think we will continue asking questions, but we are also mindful of your time. So thank you for doing this. Thank you for sharing your information. It really helps us to get some answers to the questions that we were looking for and couldn't get answers with the ready-made articles that we've been supplied. And there is so much information that sometimes our brains, at least mine, is not processing information quickly. So it's great to get this personal time with you to get all our questions answered. If there are any questions, we can maybe send an email with something.
Absolutely.
Oh, Ozgi wants to add something, so maybe we'll just give her a quick some time. Ozgi, maybe you can do a quick background about your work, about yourself, and then your question, and then your question.
Yes, I'm sorry. I don't want to take your time. I'm also working at the Center for Sustainable Development. I am a medical doctor and a public health professional. I just wanted to add that in case of any symptoms like cough or fever, etc., people shouldn't be using cough suppressant drugs that suppresses their cough. And also it's very important that people do not use anything containing steroids, corticosteroids, something that drives cortisone, because that also can increase the replication of the virus. That's why that is very important. Like I just wanted to add that, like, if you have, of course, fever, if you have cough, then you need to wait if it's a mild fever, if it's a mild cough. But if the fever is above 38 or above 140 degrees Fahrenheit, and you have severe cough, etc., then of course I think some countries have telemedicine opportunities. Some countries have hotlines that people can call without going to a health center, so that health centers and doctors are not occupied too much. If there's any chance to call a doctor, then it's better to call a doctor. If there's a chance to write an email or contact the healthcare provider via internet, then that's a better option than not going. But of course, if the symptoms are very severe, then people need to go and then examined by a healthcare provider. The only thing is that no one should use any drugs that contain corticosteroids or cortisone kind of thing to treat the cough. That's very important. I just wanted to add that.
The other thing that just came out is that they said that you should not be using any anti-inflammatory, because that also
that's actually, I think, very unfortunate that the French Minister of Health wrote in a tweet, because that is not evidence-based. It's only an observation of some physicians in France, and it's not based on a study. Therefore, I mean, there's now a chaos with all those things, but there's no evidence showing that you can't use ibuprofen, etc. But of course, this is important. Like, if you have fever, the first thing that you should use is a paracetamol, like Tylenol, Parol kind of things, not ibuprofen, because that's a stronger one that has
so not
anti-inflammatory.
Advil, because you have to give brand names.
Not Advil.
Not Advil.
Yeah, of course, not Advil, but Tylenol is always the first choice to make. If the fever is severe, that Tylenol is not enough, then of course, then you need to call a health care provider or go to a health center without trying to, suppress the high fever. That's, I mean, the best thing is to use Tylenol, but other than that, there's no evidence that it shouldn't be, ibuprofen shouldn't be used. So that's like a thing that's, now everyone is talking about it, but there's no study showing that you shouldn't use it. we just need to be careful about, of course, the drugs that we use. I mean, cortisone is very important, but other than that, just plain Tylenol should be enough for mild fever.
Very helpful.
Thank you so much. Thank you so much, Ines, for the great presentation. Thank you, Radhika, for organizing all this.
Thank you, Ozge. I think Tara, maybe last your comment and then we'll close.
Yes, thank you to Yanis and Ozge for such insightful information today. So important. I just wanted to add on something related to the economic fallout that will be part of all this. So many working families who are going to be wondering if they're going to be getting a paycheck, that we should also be calling our elected officials to encourage them to, I guess Congress on Saturday passed the Families First Coronavirus Response Act, which Trump says he'll sign, but Mitch McConnell is being a little more stubborn about it. So I think we should be calling our senators to encourage them to pass that, which would ensure 2 weeks of pay for workers, or up to 2 weeks of pay during this quarantine period. But then, you know, we're going to need to be pushing them on other things too, if this needs to get extended, eviction, you know, people not getting evicted, people not getting foreclosed on if they can't pay their rent. So I just think that that's another side of things that we can be doing, is encouraging our elected officials to help families who are going to be struggling economically during this time as well.
Thank you, Tara. I think if you have a draft or something, it will be easier, because if you say this, I know that I will not take the time to do this because I'm so lazy. So if there is a draft going around, we can definitely, you share it and we'll write our names, sign our names, or even if it is like a change.org petition or something, we can send it to the people involved, just a suggestion. So that, because I'm not very familiar with the rules and laws and things here, because half my life is in India, half here. So I get confused with both the countries. So it's helpful to give us a draft. We can sign it. If you want to start a petition, we'll be happy to share it with everyone else as well.
Yeah, I think probably phone calls or emails are best, but I can put together like an article for our our Ed4SD website with the info and how to get the phone numbers and a script that you could say and all that.
And just one last note for our young EcoAmbassadors who are on, we've just included a link on the side for you. This is the COVID-19 virus related assignment, as well as our continued discussion. So check out the link in the activity, and then we'll be in touch again for our next calls.
Next call will be tomorrow. We have Ishan, who's also on the call, sharing his work on microplastics. So super exciting. Please join back again. There's a separate link. So go to our website and you will get all the information there for the next meeting at 4 p.m. tomorrow, EST. Thank you so much. Thank you so much, Yanis, for
Thank you for organizing. What a pleasure. And thanks for everyone. Thanks to everyone for listening. Have a great evening, guys.
Thank you.
Thank you.
Bye bye.
Thank you.
Bye.